Does prediabetes really have to lead to full-blown type 2 diabetes? Many believe that once you receive a prediabetes diagnosis, it's a direct path to a life of medication and complications. However, in the United States, about 1 in 3 adults, nearly 100 million people, have prediabetes. And for many, this is a wake-up call, not a life sentence. This video is going to give you 6 critical, often overlooked strategies that can not only halt the progression of prediabetes, but in many cases, help you reverse it entirely. 1-to-1. Understanding insulin sensitivity. Insulin sensitivity is a crucial concept in managing prediabetes, yet it's often oversimplified. It refers to how responsive your body's cells are to insulin, the hormone that allows glucose or sugar from your bloodstream to enter your cells for energy. When you are insulin sensitive, your cells efficiently take up glucose, keeping your blood sugar levels stable. Conversely, insulin resistance means your cells do not respond well to insulin's signal. In this state, your pancreas has to work much harder, producing more and more insulin to try and get the glucose into your cells. Over time, this constant overwork can exhaust the insulin-producing cells in the pancreas, leading to their decline and eventually the progression to type 2 diabetes. The scientific basis for insulin resistance is complex, but involves several factors. Genetic predisposition plays a role, meaning some individuals are inherently more prone to developing it. However, lifestyle factors are paramount. Excess body fat, particularly around the abdomen, is a significant contributor. This visceral fat, as it's known, releases inflammatory chemicals and free fatty acids that interfere with insulin signaling in muscle and liver cells. Chronic inflammation, a low-grade, persistent immune response, also contributes to insulin resistance by disrupting normal cellular function. When cells are constantly inflamed, their ability to respond to insulin's message is compromised. Additionally, a sedentary lifestyle and a diet high in processed foods and refined carbohydrates can exacerbate insulin resistance. These dietary choices lead to frequent and significant spikes in blood sugar, forcing the pancreas to produce large amounts of insulin repeatedly, further taxing its capacity. The consequence of unaddressed insulin resistance is a vicious cycle. As cells become more resistant, blood sugar levels remain elevated, prompting the pancreas to produce even more insulin. This hyperinsulinemia, or high insulin levels, can lead to weight gain, particularly around the midsection, which in turn worsens insulin resistance. It also contributes to elevated triglycerides and lower levels of high-density lipoprotein, or HDL cholesterol, often referred to as good cholesterol, increasing the risk of heart disease. Therefore, simply knowing your blood sugar is high is not enough. Understanding the underlying mechanism of insulin resistance is key to effective intervention. Ignoring these signals means allowing your body to continue down a path where its primary glucose regulation system is becoming increasingly overwhelmed, setting the stage for significant long-term health issues. To truly address insulin resistance, the focus must shift from merely controlling blood sugar to improving cellular responsiveness to insulin. This involves a multifaceted approach that includes targeted dietary changes, specific types of exercise, and potentially certain supplements or medications. For instance, consuming complex carbohydrates with fiber, like whole grains and vegetables, helps slow glucose absorption, reducing the demand on the pancreas. Incorporating healthy fats and lean proteins can also stabilize blood sugar responses. Physical activity, particularly strength training, builds muscle, which is a major site for glucose uptake, thus directly enhancing insulin sensitivity. Regular physical activity can improve insulin sensitivity by anywhere from 10 to 50%, depending on the intensity and consistency. This comprehensive understanding and actionable approach can help restore your body's natural glucose regulation. 2. Strategic dietary shifts beyond counting calories. When managing prediabetes, simply cutting calories often isn't enough. The type of calories you consume is profoundly important. Focusing solely on calorie restriction without considering macronutrient balance and nutrient density can lead to nutrient deficiencies and persistent blood sugar dysregulation. Instead, strategic dietary shifts involve prioritizing foods that naturally stabilize blood glucose, enhance insulin sensitivity, and promote satiety, reducing the likelihood of overeating or cravings. Many individuals are told to avoid all carbohydrates, but this is a common misconception. The critical factor is distinguishing between rapidly digested, refined carbohydrates and complex, fiber-rich carbohydrates. Refined carbohydrates, found in white bread, sugary drinks, and many processed snacks, are quickly broken down into glucose, leading to rapid and significant blood sugar spikes. This sudden influx of glucose places a heavy burden on the pancreas, demanding a large surge of insulin. Over time, this constant demand contributes to insulin resistance. Conversely, complex carbohydrates found in whole grains, legumes, fruits, and non-starchy vegetables are digested slowly due to their high fiber content. This gradual release of glucose into the bloodstream results in a more stable blood sugar response, requiring less insulin and allowing the pancreas to work more efficiently. For example, a slice of white bread might cause a blood sugar spike 30 to 50 points higher than a serving of oats. One often overlooked aspect is the concept of food sequencing. Research indicates that consuming non-starchy vegetables and protein before carbohydrates can significantly reduce post-meal blood sugar spikes. This is because fiber and protein help to create a barrier, slowing the absorption of glucose from the subsequent carbohydrates. This simple yet powerful strategy can dramatically impact your glucose control. For example, if you are having a meal with chicken, broccoli, and rice, eating the chicken and broccoli first before the rice can lead to a post-meal blood sugar response that is 20 to 40% lower than if you ate the rice first. This isn't about eliminating favorite foods, but rather about smarter consumption. The consequence of not making these strategic shifts is a continued struggle with blood sugar fluctuations, regardless of overall calorie intake. High blood sugar variability, characterized by frequent spikes and crashes, is independently linked to increased risk of cardiovascular disease, even in individuals who haven't fully progressed to type 2 diabetes. It also contributes to chronic inflammation and oxidative stress, further damaging cells and tissues. This constant roller coaster ride of glucose levels also impacts energy levels and mood, making consistent lifestyle changes even harder to maintain. Ignoring the quality of carbohydrates and the power of food sequencing means missing out on fundamental tools for managing your blood sugar effectively. To implement effective dietary changes, focus on whole, unprocessed foods. Aim for at least half your plate to be non-starchy vegetables at each meal. Incorporate lean proteins like fish, poultry, and legumes, and healthy fats from sources like avocados, nuts, and olive oil. When consuming carbohydrates, prioritize whole grains like quinoa, brown rice, and oats. Reading food labels carefully to identify added sugars and refined grains is also essential. Remember that even seemingly healthy foods like fruit juices can be concentrated sources of sugar without the beneficial fiber of whole fruit. Consulting with a registered dietitian can provide personalized guidance, helping you navigate these shifts and create a sustainable eating pattern that truly supports your health. If you just had a light bulb moment from that tip, tapping the like button is a free way to support the channel. 3. The power of targeted exercise. Exercise is widely recommended for prediabetes, but the specific type and consistency of physical activity make a significant difference in preventing progression. It's not just about moving more, it's about engaging your muscles in ways that directly impact glucose uptake and insulin sensitivity. Many individuals start with light walking, which is certainly beneficial, but often don't realize the compounded benefits of incorporating strength training and more intense aerobic activity. In the United States, physical inactivity is a major risk factor for prediabetes, with a significant percentage of adults not meeting recommended activity guidelines. When you engage in physical activity, your muscles use glucose for energy, directly lowering your blood sugar levels during and immediately after exercise. More importantly, regular exercise enhances insulin sensitivity in muscle cells. This means your muscles become more efficient at taking up glucose even when you are at rest, requiring less insulin to do so. Think of it like this. Exercise acts as a key that unlocks your muscle cells, making them more receptive to insulin signal. This improved insulin sensitivity can persist for hours, and with consistent training, it becomes a lasting adaptation. Studies have shown that even a single bout of moderate exercise can improve insulin sensitivity for up to 48 hours. The most impactful types of exercise for prediabetes include a combination of aerobic activity and strength training. Aerobic exercises, like brisk walking, jogging, cycling, or swimming, improve cardiovascular health and help burn calories, contributing to weight management. Aim for at least 150 minutes of moderate intensity aerobic activity per week, which translates to about 30 minutes on most days. Strength training, however, is often underestimated. Building muscle mass is particularly beneficial because muscle tissue is a primary site for glucose disposal. The more muscle you have, the more places your body has to store and utilize glucose, thereby reducing its accumulation in the bloodstream. Incorporating strength training 2 to 3 times per week, working all major muscle groups, can have a profound effect on your glucose metabolism. This could involve lifting weights, using resistance bands, or even body weight exercises like squats and push-ups. The consequence of neglecting targeted exercise is a missed opportunity to directly address insulin resistance. Without regular physical activity that challenges your muscles, your cells remain less responsive to insulin, forcing your pancreas to continue its uphill battle. This lack of metabolic flexibility means your body relies more heavily on insulin to manage glucose, contributing to the cycle of insulin resistance and potential pancreatic burnout. Furthermore, inactivity often leads to weight gain, especially abdominal fat, which, as we discussed, directly worsens insulin resistance. Without the muscle-building benefits of strength training, your body's capacity to absorb glucose from the blood remains suboptimal. To effectively harness the power of exercise, start gradually and find activities you enjoy to ensure consistency. Consider a combination of brisk walking for 30 minutes most days and 2 days of strength training using dumbbells or resistance bands. Even short bursts of activity, like walking for 10 minutes after each meal, can make a difference in post-meal blood sugar levels. Always consult your healthcare provider before starting any new exercise regimen, especially if you have existing health conditions. This proactive approach to physical activity is a cornerstone in preventing prediabetes from advancing. 4. Quality sleep's unseen impact. Sleep is a fundamental biological need, yet its profound impact on blood sugar regulation and prediabetes progression is frequently underestimated. Many individuals focus primarily on diet and exercise, overlooking how poor sleep can silently undermine their best efforts. It's not simply about getting enough hours. The quality of your sleep directly influences hormone balance, insulin sensitivity, and even food cravings. Roughly 1 in 3 adults in the United States report getting less than the recommended amount of sleep. During sleep, your body undergoes crucial restorative processes. When sleep is insufficient or of poor quality, it disrupts the delicate balance of hormones that regulate appetite and blood sugar. Specifically, inadequate sleep can increase levels of cortisol, a stress hormone, and decrease insulin sensitivity. It also affects ghrelin and leptin, the hormones that control hunger and satiety. Ghrelin, the hunger hormone, increases with sleep deprivation, while leptin, the satiety hormone, decreases. This hormonal imbalance can lead to increased appetite, particularly for high carbohydrate and sugary foods, making it significantly harder to stick to a healthy eating plan. Imagine trying to make disciplined food choices when your body is sending strong, confused hunger signals all day long. The scientific connection is clear. Chronic sleep deprivation, defined as consistently getting less than 7 hours of sleep per night, is linked to increased insulin resistance. Studies have shown that even a single night of poor sleep can cause a temporary state of insulin resistance in healthy individuals, mimicking what's seen in prediabetes. Over time, this cumulative effect can contribute to the permanent development of insulin resistance and, consequently, type 2 diabetes. Furthermore, conditions like obstructive sleep apnea, where breathing repeatedly stops and starts during sleep, are strongly associated with insulin resistance and an increased risk of prediabetes and type 2 diabetes, regardless of weight. The intermittent hypoxia, or lack of oxygen, experienced during sleep apnea places significant stress on the body, further impairing glucose metabolism. The consequence of neglecting sleep is a direct undermining of your efforts to manage prediabetes. Even if you are diligent with diet and exercise, chronic sleep issues can make it an uphill battle. Your body's cells will remain less responsive to insulin, your hunger hormones will be dysregulated, and you'll likely experience increased cravings, particularly for quick energy fixes that lead to blood sugar spikes. This creates a challenging cycle where poor sleep drives poor dietary choices, which in turn negatively impacts blood sugar, further contributing to the progression of prediabetes. Ignoring sleep means leaving a critical factor for glucose control unaddressed, making sustained progress difficult. To optimize your sleep for blood sugar management, prioritize consistent sleep schedules, aiming for 7 to 9 hours of quality sleep each night. Create a relaxing bedtime routine. Ensure your bedroom is dark, quiet, and cool, and limit screen time before bed. Avoid caffeine and heavy meals close to bedtime. If you suspect you have a sleep disorder like sleep apnea, it's crucial to consult a healthcare professional for diagnosis and treatment. Addressing sleep issues is a powerful, often overlooked strategy that can significantly improve your insulin sensitivity and support your journey away from prediabetes. 5. Stress management and its metabolic links. Chronic stress is an insidious factor in the progression of prediabetes, yet its metabolic consequences are frequently underestimated. In our fast-paced lives, managing stress often takes a back seat to more overt health interventions like diet and exercise. However, the physiological response to stress directly impacts blood sugar levels and insulin sensitivity, making effective stress management a critical component of prediabetes prevention. More than 1 in 4 adults in the United States report experiencing high levels of stress daily. When you experience stress, whether it's physical, emotional, or psychological, your body activates its fight or flight response. This involves the release of stress hormones like cortisol and adrenaline. These hormones are designed to provide a rapid energy boost by signaling the liver to produce and release more glucose into the bloodstream, making it readily available for muscles to use during a perceived threat. This evolutionary mechanism was essential for survival in prehistoric times. However, in modern life, chronic stress leads to a persistent elevation of these hormones, resulting in continuously elevated blood sugar levels. The long-term presence of high cortisol in particular contributes to insulin resistance. Cortisol directly interferes with insulin's ability to facilitate glucose uptake by cells, making them less responsive. This means your pancreas has to work even harder, producing more insulin to try and bring blood sugar down, similar to the effects of poor diet and lack of exercise. Chronic stress also often leads to other unhealthy coping mechanisms, such as emotional eating, increased consumption of sugary or processed foods, and reduced physical activity, all of which further exacerbate insulin resistance and weight gain. Think of it as a compounding effect. Stress not only directly raises blood sugar, but also encourages behaviors that further disrupt glucose control. I know there's a lot of debate online about metformin. We're going to cut through the noise and look at the clinical studies. The consequence of unmanaged chronic stress is a constant internal environment that promotes high blood sugar and insulin resistance, regardless of other efforts. It's like trying to bail water out of a leaky boat without plugging the hole. Even with dietary changes and exercise, if your body is constantly flooded with stress hormones, you are fighting an uphill battle. This persistent elevation of glucose and insulin increases the risk of pancreatic burnout, ultimately accelerating the progression to type 2 diabetes. Moreover, chronic stress contributes to systemic inflammation, which further impairs insulin signaling and increases the risk of other diabetes-related complications, such as cardiovascular disease. To effectively manage stress for prediabetes prevention, integrate stress reduction techniques into your daily routine. This could include mindfulness meditation, deep breathing exercises, yoga, spending time in nature, or engaging in hobbies that you find relaxing. Even 5 to 10 minutes of dedicated relaxation each day can make a difference. Prioritizing adequate sleep, as discussed previously, is also a powerful stress reducer. If stress feels overwhelming, consider seeking support from a mental health professional or counselor. Addressing stress isn't just about feeling better. It's a vital physiological intervention for maintaining healthy blood sugar and preventing the onset of type 2 diabetes. 6. The role of regular monitoring and professional guidance. While lifestyle changes are powerful, consistent monitoring and professional guidance form the bedrock of preventing prediabetes from progressing. Many individuals, once diagnosed with prediabetes, may not fully grasp the importance of ongoing blood sugar checks or the value of a healthcare team. Relying solely on general advice without personalized insights and regular feedback can lead to missed opportunities for timely adjustments. In the United States, a significant number of individuals with prediabetes are unaware of their condition, highlighting the critical need for testing and follow-up. Regular monitoring provides objective data on how your lifestyle changes are impacting your blood sugar levels. This isn't about rigid control, but about understanding your body's unique responses. Key metrics include fasting blood glucose, which measures your blood sugar after an overnight fast, and the A1C test, which provides an average of your blood sugar over the past 2 to 3 months. A fasting blood glucose level between 100 and 125 milligrams per deciliter, or an A1C between 5.7% and 6.4%, indicates prediabetes. Tracking these numbers allows you and your healthcare provider to assess the effectiveness of your interventions and make necessary adjustments. For example, if your A1C isn't improving despite consistent efforts, it might signal a need for different strategies or the consideration of medication. Professional guidance from a healthcare team, including a doctor, a registered dietitian, and possibly a certified diabetes educator, offers invaluable personalized support. A doctor can assess your overall health, identify underlying conditions that might contribute to prediabetes, and discuss medication options like metformin if appropriate. Metformin is often prescribed for prediabetes, particularly for those with a body mass index over 30, a history of gestational diabetes, or those under 60 years of age, and it has been shown to reduce the risk of progressing to type 2 diabetes by about 30%. A dietitian can help you develop a personalized eating plan that accounts for your preferences, lifestyle, and specific metabolic needs. A diabetes educator can provide practical advice on self-management, including meal planning, exercise routines, and proper monitoring techniques. This collaborative approach ensures that your efforts are targeted and effective. The consequence of neglecting regular monitoring and professional guidance is flying blind. Without knowing your numbers, you cannot accurately gauge the effectiveness of your lifestyle changes. You might be putting in significant effort, but unknowingly missing crucial elements that are specific to your metabolism. This can lead to frustration, demotivation, and ultimately, the progression of prediabetes. Furthermore, without professional oversight, potential complications or coexisting conditions, such as high blood pressure or high cholesterol, might go unaddressed, increasing your overall health risk. Self-management is vital, but it is most effective when guided by expert knowledge and data-driven insights. To leverage the power of monitoring and guidance, schedule regular checkups with your doctor to discuss your A1C and fasting blood glucose levels. If comfortable, consider investing in a home blood glucose meter to track your immediate responses to different foods and activities. This real-time feedback can be incredibly empowering. Don't hesitate to seek referrals to a registered dietitian or a diabetes educator. These professionals can provide tailored strategies that make a tangible difference. This commitment to ongoing assessment and expert support is perhaps the most crucial step in ensuring you prevent prediabetes from progressing and safeguard your long-term health. If you enjoyed this video, you will probably also like this one. Please subscribe to this channel and let us know in the comments your thoughts. Thanks for watching.